I'm very happy to have been appointed to the Governor's Alzheimer's disease plan working group. So I'm one of about maybe 15 to 20 members of that working group, and we will be working hard to assess, the need in the state of Kansas for fighting Alzheimer's disease. So we'll look at where we are now in terms of how many people have Alzheimer's and what kind of resources already exist. And then the goal is really to mobilize those resources and bring them together so that we can best, as a state, fight Alzheimer's disease. Alzheimer's is a huge problem, and it's only growing. So there's about 5 million Americans, or over 5 million Americans, who have Alzheimer's disease, and about 52,000 Kansans are estimated to have Alzheimer's disease. And it's growing rapidly. We're going to see about a 20% increase in the next decade in people affected by Alzheimer's. So it's a huge problem. It's a huge burden. We're all at risk, and as we get older, the risk gets higher. I think one of the most, sort of scary statistics is about 1 out of 3 people over the age of 85 have Alzheimer's. So 1 out of 3 people over the age of 85, and that's the fastest growing segment of our population. And so as a result, we're seeing a huge increase in the number of people with Alzheimer's disease, and we need to do more to fight it. We're not ready for that, and so we need to think about it holistically as a state. And understand what we can do to prepare and to better fight it. We have this huge problem, and we don't have a cure for it, and we don't have proven ways to prevent it. On the other hand, we're working really hard in terms of research to try to understand how to prevent the disease and to cure it. Having said that, we do have treatments for Alzheimer's disease. We have drugs that can help people with Alzheimer's disease. And so I think it's important to remember that we can diagnose and we can treat it. But to really impact the disease, we need a cure or a prevention strategy. And so, research is incredibly important in moving that forward. And that's something we've been working on for the last decade and a half, really. Is to better understand what we can do to prevent this disease and better understand how we can treat it more effectively. And we're making rapid progress. I just came from a meeting in Chicago, Alzheimer's Association International Conference, where all the world's researchers get together and share data and results, and there's exciting stuff going on, and we're contributing to that. We're working hard to understand better how exercise and diet can reduce one's risk of Alzheimer's, and we're testing the latest drug approaches to treating the disease. So there's a lot going on, and we're really hopeful in the next 5 to 10 years we're going to have much more effective approaches to treating the disease. Now, when that day comes, I don't think we're prepared to deliver that kind of care or the cure across the population. So it's really important to think about how do we set ourselves up as a state to deliver that care that's needed on the day that a drug is developed that can cure Alzheimer's disease. And so building that network and building that health system that can do that is incredibly important. We have reasons that we want to do it right now, and I think the other big reason, to better care for people with Alzheimer's disease, but the other big reason is to prepare for that day when new drugs are developed and are shown to be effective and need to be distributed to the patients that are all over the state. In terms of developing a new drug for Alzheimer's disease, the number one barrier to getting there is finding patients to participate in trials. We have to test the drugs, and we have to test them in a rigorous way, and the only way we're going to get to a cure is through clinical trials. And one way of thinking about it is the first person cured of Alzheimer's disease will be in a clinical trial, and we'll do that through a clinical trial. So it's incredibly important that people participate and think about how can they participate in research. We're always looking for people. We're always working hard. We have a team of people who all they do is think about how can we find individuals who can participate in these trials. It is the number one barrier to us getting the studies done and moving our science forward. So it's a huge effort and a huge problem. is how do we do that, locally, but how do we do it across the country? There's just not enough research participants now to finish the studies that we're launching and currently performing. So that's where some group like the Global Alzheimer's Platform and John Dwyer come in, and they've actually helped us. We've partnered with them for the last year and a half to work on ways, how can we accelerate our research recruitment? How can we accelerate that participation of our patients in trials and reach more people? And they've played a big role in our moving that forward. And that New York Times article that featured them this week was fun to see them featured in it, and I think that it's going to bring a lot of success to speeding our efforts to find a cure. We're the University of Kansas Alzheimer's Disease Center, and we're one of 31 nationally designated centers in the country. That's a big deal to be designated as one of these centers. It means we have a lot of research that's ongoing. We have built up a lot of infrastructure to move that research forward. And so we have a portfolio of studies, a broad portfolio of studies that we're supporting. Everything from what you'd expect, drug studies that are working towards a cure, to prevention studies, which you maybe don't think of as much, and that's exercise studies, diet studies, studies where we're actually looking not for people with memory problems or Alzheimer's disease, but we're looking for people without memory problems. We're trying to understand if somebody's healthy, how do we keep them healthier longer or indefinitely. And we think diet and exercise has a big role to play in preventing Alzheimer's or delaying the onset. So if you look at across our studies and how many people we need to finish those studies, we probably need 600-700 people who don't have Alzheimer's disease compared to maybe 100 to 200 who do have Alzheimer's disease. So our need for research participants isn't just people with memory problems. It's for a lot of people who don't have memory problems. And they can play a very big role in moving the science forward in terms of, how can we prevent or delay the onset of Alzheimer's in people who are healthy. We've been researching exercise and diet for a good decade now and think it has a role in reducing one's risk of Alzheimer's disease, and there's a lot of data that supports it. So what we've done is taken everything we've learned in the lab and our colleagues have learned in the lab, packaged it up and created a program that's called LEAP. LEAP stands for Lifestyle Empowerment for Alzheimer's Prevention. And what the program does is translates all the knowledge that we have and the evidence that we have on exercise and diet into a nice package that people can then use to incorporate those exercise and diet strategies into their life. So we're translating the evidence into a way that people can incorporate it into their life with the goal of reducing an individual's long-term risk of Alzheimer's disease. We have a great partnership with the YMCA. We're testing the idea of a doctor prescribing the LEAP program and the YMCA carrying that out with the patient. And so the YMCA has been a great partner. We're building this program within the YMCA infrastructure, and we're actually developing tools where doctors can prescribe the LEAP program or prescribe exercise and diet, which we know patients have a hard time carrying out those prescriptions. But we want doctors to leverage exercise and diet and use it in their practice to make their patients healthier. And not just heart and lung healthier, but brain healthier. We think exercise and diet improves brain health, and we're developing the methods to translate that into daily life through the LEAP program. If someone's interested in participating or getting involved with our research, they can go to our website, kualzheimers.org, or give us a call at 913-588-0555.